So basically, we have been discussing this like for all the topics. We have already covered this topic, this question series with you guys. This is not only the question series, rather, you can say we have we this is a kind of doubt solving session as well. And we have been doing this, right? So this is a final session now. And in this session, we are going to discuss neuroanatomy and the systemic histology and the embryology part. So this is a question, beta. Tell me, what do you think will be the answer? Yes. What will be your answer? So basically, if you look at this way, we have this is the part which is called as corpus callosum, and in between we have a septum. This septum is what is called as septum pellucidum. This septum is what is called as septum pellucidum. Okay, septum pellucidum. Which is the septum between the two, you can say lateral ventricle. Okay, like that. And the mark structure is this one. This is a mark structure, which is actually having bilateral arrangement, but I'm just showing in a dotted manner just for the schematic way. This is what is called as fornix. These two separate things are the columns. If I show you the real structure, this is the column here. This is the fornix. Two columns are there of the fornix. Okay. Now, dear friends, this fornix basically is the efferent coming from the hippocampus. A will be the answer, and it is afferent to the mammillary body. And we can remember one mnemonic over here that is called as hippomace. What is hippomace? Hippomace is nothing but the Pepe circuit. It is the Pepe circuit, which is concerned with the mammary. From the hippocampus to the mammillary body, these fibers will go in the form of fornix. And from the mammillary body, they will go to anterior nucleus of the thalamus. Anterior nucleus of thalamus. Then from here, it will go to the cingulate gyrus. And cingulate gyrus, after that, it will go to the entorhinal cortex. Entorhinal cortex. And then from here, it will go to the hippocampus. Like this. I hope that makes sense now. Yes. So now this question, and we have again a marked area. What is the marked area? First of all, let me zoom in to help you guys. We can see this is a corpus callosum, and this is the posterior part. So it is the splenium, that's the body. That bend is called as genu, and this portion is the rostrum of the, this is the rostrum part. This is the rostrum part, that is nothing but, you can say, it's like part of the corpus callosum, and it is going to connect which part of the orbit, which part of, you can say, brain matter, right? So here we can check among this option, answer will be orbital cortex. How come orbital cortex, beta? Can you make a guess? Let me make it easy for you. Anterior most part is the genu, and anterior most part is the frontal lobe. So frontal lobes will be connected by the genu. This is the genu, which is going to connect the anterior aspect of the frontal lobe. But below the frontal lobe, you just imagine here, this is the genu part, right? Below we have the rostrum. Below this part, we have the orbit. Behind the orbit, we have the brain, which is called as orbital cortex. Why? Because it is just behind the orbit. Please mind it, even though the name is orbital cortex, it has nothing to do with the vision. Okay? Only the name is orbital cortex because it is behind the orbit. That's it. So now this rostrum is going to connect the orbital cortex. I hope that makes sense. Yes. Now, dear friends, next question is this. This one is the orbital cortex. The marking was at the, yes, Xavier, very good, beta, very good. Both the answers are correct. If it is like on the anterior aspect of the genu, then it will be frontal lobe. But the marker is little below in the rostrum part. That's why orbital cortex. Okay. Now we can say this. Again, a marker on the corpus callosum. Yes, everyone, quickly answer. This is the part of the corpus callosum, but the posterior part. So right now we are in the posterior part. So what we can see is splenium. Particularly splenium will get the dual blood supply. Why? because it is a transition zone between the two blood supply. So, like it will be getting the supply from two arteries. Can you guess, beta? Answer will be ACA and PCA. Why? Let me show you this. Look at this way. We have this area which is the ACA territory. This area is the PCA territory. Particularly splenium is here, which is at the junction between the ACA and the PCA territory. So it will be getting the supply from both the arteries. From here, it will be getting supply from ACA and PCA. I hope that makes sense now. Yes, B will be the correct answer, beta. Now the next, or if you see this way, we have the Wernicke's area here, Broca's area here. So all the speech area is supplied by MCA. Okay. And the visual area is supplied by PCA, like that visual area. Even though visual area is supplied by PCA, but macula is having again dual blood supply. Macula will be supplied by PCA plus MCA. Now this question, damage to the structure which is the producing the marked elevation. So first of all, what is the marked elevation? Let me explain this way. We have got this, that is the floor of the fourth ventricle. I hope you guys must have identified this. We can see these four bodies. What are these four bodies? These are superior and inferior colliculi. That is, we are looking at the dorsal aspect of the midbrain. Superior peduncle, middle peduncle, inferior peduncle. Okay. And this is the floor of the fourth ventricle. In this part, we have the elevations. These elevations are nothing but the facial colliculus. Now, if this is the facial colliculus, I say this is the facial colliculus. And let me label the other structure. I can say that we have the superior colliculi, this is the inferior colliculi, superior cerebellar peduncle, middle cerebellar peduncle, inferior cerebellar peduncle. Okay. So who is producing the facial colliculus? It is the seventh nerve around the sixth nerve nucleus. But who is producing? Seventh nerve. So seventh nerve is gone, risorius will be affected, and the risorius is nothing but the muscle of grinning, which is a facial expression, right? Muscle of grinning. So we can say that will be gone. If they change the language of the question, suppose they say, if the structure deep to the marked elevation is gone, who is deep to it? That is sixth nerve nucleus. Then we will mark lateral rectus as the answer. This is what I hope that makes sense now. Yes. Now this image is given to us. Yes, very good, beta. And now tell me this ABCD marker, which one is false? Corpus callosum A, that is very much correct. B is the fornix, very much correct. In between we have, this is the septum pellucidum. The septum is there in between. That will be septum pellucidum. Okay. But what about D? D is the cingulate gyrus, which is also correct. But what about C? Is not the optic nerve. Optic nerve is over here. This is the oculomotor nerve. So C is the answer. That's wrong. Answer is C. Because this is the optic nerve over here. Please check. The given was oculomotor nerve. And I am providing you this, the whole labeled picture. You can just, very good, but a correct answer. So till now, you guys have been telling most of the answers correct. Yes. Only one catch was there. That was the arterial supply, right? But that's okay. Now let's move on. And now again a brainstem. And this has been given to you gross anatomy. Okay. And one marker is there on one nerve coming out of the junction. That's a hint. We can see this is the pons, that's the medulla. Okay. And above that will be midbrain. So junction will be pontomedullary junction. At the pontomedullary junction, we have 6, 7, 8 nerve. But if this nerve is a sixth nerve, that will be the answer. And this is the given picture. You can identify each and everything. From the ventral aspect, you can see all. But when you change the view to the dorsal aspect, you can see the fourth nerve, because the fourth nerve is the only nerve which exits from the dorsal aspect. Then it winds around and comes ventrally and supplies like that. Now this question, beta, internal capsule has what type of fibers? What will be your answer? Internal capsule. We know the internal capsule is nothing but the condensation of ascending and descending tracts. Okay. those tracks are coming from below the cortex and they are going to connect the area within the cortex. So that's why that belongs to the projection fiber. Answer will be C. Why? Because what is association fiber is the one which is connecting the two areas in the same hemisphere. That will be association fiber. And association fiber, one of the example is arcuate fasciculus. Arcuate fasciculus, which connects the Wernicke's to the Broca's within the same hemisphere. But if you see this way, we have the two areas in the different hemisphere and they are getting connected. That will be commissural. For example, that will be like corpus callosum. Like corpus callosum or any other commissure, we have anterior commissure, we have posterior commissure, anything which are connecting, that will be called as commissural. What is projection fiber? Which is connecting the area in the cortex to the area in the subcortical level, that will be called as projection fiber. Is that okay? So projection fiber example is internal capsule, is a typical example. Okay. And there is, with this, you please remember fornix. We have seen fornix in the first question. If they ask fornix is having what type of fiber, then what will be your answer? Yes. Another question, beta. Another question. Tell me, fornix is having what type of fibers? Can you guess? Fornix is having all three set of fibers: association, commissural, and projection fibers. But in the Gray's Anatomy, 41st edition of the Gray's Anatomy, it is given fornix has been described under association, also under the commissural fibers. So now we have got two answers. What is to be marked? Let me help you here. If you get a question, fornix is having what type of fibers is the question. In the choices, if you have been given like A, C, and P, association, commissural, projection, all are given, that's the best answer. Without any doubt, you go with that because like all the books are saying so. Even in the Gray's Anatomy, it is not given that it is not projection. Only thing is, it has not been described under the projection. Okay. Rest all the books are saying that ACP is there. But by chance, if the like option is not like A, C, and P, option is just like combination A and C, C and P, like that. In that case, go with A and C like that. Okay. So depending upon the what choices you have got, then you have to mark the correct answer. So are you able to solve these type of questions beta now? Confident? Confident is neuroanatomy as well? Yes. Molecular layer of the cerebellum. As we also know that cerebellum is one of the very important topic. We must know everything about it. We must know the archicerebellum, paleocerebellum, neocerebellum. Okay. Then we must know the lobes. We must know the deep nuclei and the layers. Everything is important here. So talking about the molecular layer, we have two cells, basket cell and the stellate cell. Among the given option, answer will be basket cell because basket and stellate cell will be seen in the molecular layer. These two cells are seen in the granular layer. And the Purkinje cells are seen in the Purkinje layer itself. The name itself is Purkinje. What about this? We can just quickly revise the name of the deep nuclei. We have the mnemonic doctors eat good food. So we have the dentate nucleus. We have the emboliform, E for emboliform, G for globose, and F for fascicle. What is the mnemonic? Doctors eat good food. The mnemonic says doctors eat good food. Do we really? Hardly, never. No problem. So we can just remember dentate, emboliform, globose, and fascicle. Particularly globose plus emboliform taken together is like nucleus interpositus, which is the nucleus of paleocerebellum. Dentate is the nucleus of neocerebellum. And here we have fascicle, which is the nucleus of archicerebellum, like that. Making sense? Now, dear friends, in the real histological picture, it will be looking like this. Then how to proceed? Let me give you a hint. You check this particular layer, which I am highlighting. These cells are neither fitting here nor fitting here. So this is a layer in itself, we'll say Purkinje. We can say this cell is behaving a layer itself. There's a Purkinje layer. On one side, you will see the black dots. That will be granular layer. Other side will be molecular layer. That's how you have to proceed. Okay, like this molecular layer, this is the Purkinje layer, and this is the granular layer. Now, what you can see, basket cell, stellate cell in the molecular layer, Purkinje cell in the Purkinje layer, and these are the climbing fibers. Climbing fibers are those fibers which are coming from olivary nucleus, and the others, these are granule cells which are helping the mossy fiber to proceed, because mossy fiber are coming from all other sources. They will be heavy, they can't reach up, so they will be going via the granule cells in an indirect manner like that. So far so good? Yes, very good, beta. Just like teardrop, that's the shape. Good to see that you have identified them, right? Now the next question. First of all, can you identify the given condition here? Yes, beta. Everyone. This question is open for everyone. Can you make a guess? What is the given condition? The patient has come with the absent thymus. So thymus is absent. And also he is having the features of hypoparathyroidism and tetany is there. So this given condition is known as what syndrome? Yes. Can you make a guess? The name of the syndrome will be Digeorge syndrome. And now the point is, among these pharyngeal pouches, which one is defective? So we have to find out from where the thymus will be found, because that is completely absent. Looking at the first, let me tell you, from the first arch, there will be tubotympanic. The meaning is there will be tube. Which tube? Auditory tube. And which tympanic? Tympanic cavity, means the middle ear. So auditory tube and the middle ear will be formed from the first pouch. Second pouch will make the tonsil and the tonsillar fossa. Third pouch will make the thymus and inferior parathyroid, like that. Fourth pouch will make the ultimobranchial body and the superior parathyroid. What is the fate of ultimobranchial body? What really happens? So ultimobranchial body is the one which makes the C cells. Now there should be one confusion, because when you read the neural crest cells, you will study the neural crest cells are making the C cells. Here I am writing ultimobranchial body is making the C cells. So this is a contradictory statement, and you will be confused that sir is telling ultimobranchial body, but in the list also it is given C cells. So now what is to be followed? Let me tell you, ultimobranchial body is the structure and neural crest cells are the migratory cells. For example, when the heart is developing, the neural crest cells will reach the developing heart region, and there they will make certain structures, for example, AV cushion. And through the AV cushion, they will make certain structures. So the neural crest cells are the migratory cells which will be reaching in the developing regions, and there they will make the structures. And here, neural crest cells, which are the migratory cells, will be reaching over here in the body, ultimobranchial body, and through this body, they will be making the C cells. So which cells are responsible for the formation of C cells? Answer: neural crest cells. But who is making the C cells? Ultimobranchial body. I hope that makes clear now. Is it all clear, beta? You got the idea? This confusion should be clear. Clear now? Yes, very good, beta. Very good. Now this, I have put one histological slide, and I hope you will be able to identify this cell layer, which is neither fitting here nor fitting here, will be called as layer in itself. That is the Purkinje layer. On one side we have black dots, that's a granular layer, and this is the molecular layer, correct? So who has been marked here? Purkinje cells. Question is, Purkinje cell will be inhibitory to what? They will be inhibitory to the deep nuclei of the cerebellum, because if they ask you the output of the cerebellar cortex, then answer will be Purkinje cell. Okay, so if they ask you output cell from the cerebellar cortex, then answer will be Purkinje. Output cell from the cerebellum as a whole, then answer will be deep nuclei. So far so good? Yes, very good. That's the no. That's require little bit of correction, beta. That is requiring little bit of correction. You are getting it little in reverse order. Let me tell you, this cell is also inhibitory. Other cells are also inhibitory. Only one excitatory cell is here. That is the granule cells. Let me tell you, rest all are inhibitory. Only excitatory cell will be granule cells. Please remember this. Okay? सिर्फ ग्रेन्यूल सेल्स एक्साइटेटरी होते हैं, बाकी के सारे इनहिबिटरी हैं। ये बहुत हैवी कलेक्शन है इनहिबिटरी न्यूरॉन्स का। ठीक है, याद रहेगा। वेरी गुड। SRY, द नेम इज SRY having two meaning. One, sex determining region of Y chromosome. So sex determining region on the Y chromosome. And the other full form is S for short, arm of Y. SRY. Short form of Y. Will you remember this like that? ये आसानी से याद हो जाएगा, कोई दिक्कत ही नहीं है। SRY की दो फुल फॉर्म है। Sex determining region on the Y chromosome. If it is there, then the testis will be formed. We all know, right? Then there will be, you see, one event will lead to the other. Testosterone will be present. Mullerian inhibitor will be present. Mullerian duct will be inhibited. Testosterone will lead to the formation of the Wolffian duct. Okay. And outside we have the testosterone getting converted into dihydrotestosterone with the help of 5-alpha reductase. And that will lead to the formation of the male external genitals. So this is how one thing will lead to the other like that. Okay. If Y is absent, testis will not be formed. Testosterone will not come. If the testosterone is not there, then everything will go in the favor of the formation of female genitals. So far, so good. Now this. Which type of tongue papilla lacks taste bud? Straightforward answer, filiform. Because the filiform papillae, they are having what? They are having stratified squamous epithelium present above them. This will be like this, like this. The shape is filiform like this. Foliate are the rudimentary in human. Fungiform papillae, they are responsible for, you can say, the red dots. If you observe the tongue in the mirror, you will observe the red dots are there. Why? Because the vessels are reaching up to the tip within this papillae. Okay. First carpal bone to ossify. So I will always say, when the team enters the ground, who is the first to enter? Captain. Captain enters first. So capitate is the first to ossify. Answer is this. But if I also explain this way, we have the 8 carpal bones. Okay, like this, we can make. And we all know the mnemonic, she looks too pretty, try to catch her. Correct? So S looks like 5. So S looks like 5, it will scaphoid will come in the 5th year. This is equal, this is equal. This will also come in the 5th year, this will also come in the 5th year. This is the bone at the 3rd place. So name is triquetrum. The name is also tri and comes also in the 3rd year. So it is in the 3rd year. Between 5 and 3, number is 4. So unit will come in the 4th year. It's easy way. Okay. Captain comes first, followed by hamate. Both are in the 1st year itself. But captain comes first. You will remember this way. Capitate will come in the 1st. If you go into detail, it is in the 2nd month, followed by the 3rd month for the hamate. But no need to remember the details. Simply remember captain comes first. So the first bone, carpal bone to ossify will be capitate. Next will be hamate. Now, what about the pisiform? You add this way. 5 plus 4 plus 3 is equal to 12. Or either way you add this way. 5 plus 5 plus 1 plus 1 is equal to 12. So either you go this way or this way. Answer will be 12 only. Pisiform will appear in the 12th years of age. But if they specifically ask, pisiform appears in female, then answer will be 9 to 10. Because in case of female, all the epiphyses, they will ossify a little early. Now, which of the following is an example of the traction epiphyses? Now, when we say pressure epiphyses will be those which are making the joint. Okay, like condyle is an example of pressure epiphyses. The trochanters, tubercles, epicondyle, that will be the traction epiphysis, jutting out part of the bone. Coracoid process is a typical example of the atavistic epiphysis. And the head of first metacarpal is the aberrant epiphysis. Now, if they say dense irregular tissue, I'll give you the concept. It will take only 2 minutes, and after that, you will be able to solve all these type of questions. Answer is correct. That is B, dermis. But what is the concept? Let me explain this way. We have the loose tissue where the gap is more. We have the dense tissue where the gap is less and the tissue is compressed like that. In the dense, we have two type of tissue, irregular and regular. When we say regular, means the fibers are parallel to each other and unidirectional fibers are there. But when we say irregular, fibers are multi-layered. Now, if you talk about a muscle, muscle is having the tendon. Muscle fibers are arranged in one layers, one direction. So tendon is an example of regular. Flat tendon is equal to aponeurosis, that is also regular. And ligament is also regular. So, okay, I will explain the atavistic also, no problem. So, tal is the mnemonic here. Tal is the mnemonic. ठीक है? ये हो गया रेगुलर के 3 एग्जांपल हैं, टेंडन, एपोन्ड्रोसिस, लिगामेंट, दैट्स इट. फिर इरेगुलर क्या है? Irregulars are the covers. Because when you look at the cover will be all around, means fiber in all the direction. For example, dermis. Dermis is a cover. Capsule for the gland, capsule is a cover. For the muscle and the nerve, we have the sheath. Sheath is a cover. Adventitia of the blood vessel, that is the outermost layer, that is a cover. So basically, all of them are justifying for the cover. Periosteum, perichondrium, perimysium, perineurium, all these are nothing but the covers. What about the loose tissue? Whatever we remember from the first year, that's more than sufficient. For example, we all remember lamina propria. We all remember submucosal tissue, loose irregular tissue. Like those type of tissues are all examples of loose tissues. Now, if you look back, this question you attempt again. Lamina propria, dermis, and these are given to us. But when you look at the start of the question, dense irregular tissue, first of all, your approach to the question is changed because now you are looking at dense irregular means you are searching for the cover because we know dense irregular is equal to cover. That means we can say that you see it is like dermis this answer because only one can justify for the cover. Rest all, they are not justifying for the cover, but the problem here is we now know which they belong to what category. Lamina propria belongs to loose and these two belong to dense regular. Because we have learned dense regular, only 3 tissues were there and the mnemonic was tal. You remember now? Atavistic that you have asked the question about. Atavistic is nothing but the, you can say, those are the individual bones in case of lower animals. Those are the individual bones in case of lower animals, but in case of human, they are the part of other bone. For example, coracoid process. Coracoid process is an example of, it's a separate bone in case of lower animal, but in case of human, it is a part of scapula. That's why it is called as atavistic. ठीक है, atavistic में 2 ही एग्जांपल है, हमें 2 ही याद करने होते हैं बस. So far so good. Now this question, the patient burned the skin. Skin does not have any GSE nerve. No. No GVE is present. Parasympathetic has nothing to do with the skin. And skin does not have any trophic hormone production. So if A, B and C do not even exist in the skin. But we do we have the exocrine gland? Yes, we have 2 type of glands, sweat gland, sebaceous gland. And both are present, those will be gone. So what is present will be affected. Those are not even present. How will be they affected? They will not be affected, correct? Now this question, beta, arch of aorta. Arch of aorta के लिए क्या आंसर लगाते हो? Arch of aorta, majorly we have to remember this. Left fourth arch artery. Along with that, the components are left dorsal aorta and the left horn of aortic sac. But second arch artery is the remnant. It makes the remnant. Stapedial artery and the hyoid artery. Not the arch of aorta. That's why B will be the answer over here. I hope everything is okay. Now, talking about the vitelline vein, it makes the ship structure. It makes the ship structure. What is ship structure? We know that it makes superior mesenteric vein, H for hepatic vein, I for IVC, P for portal vein. But it does not make the superior vena cava. That's why answer will be B. Now solve this question for me. Look at this couple. In this couple, they are infertile. That's okay. But whenever we are evaluating the couple for the infertility, we will evaluate both the partners, okay? Male and female both, right? But in this case, in this given question, the the wife in question is fertile because she had the child from the previous marriage. So that is out of question that she's definitely fertile. Now, who will be infertile? Of course, the male partner is infertile. And also, you look at the history, there's a chronic history of the lower respiratory tract infection. That chronic history is there. So, respiratory tract and the reproductive tract, basically, in them, the cilia is not working. That's why, like it's a primary ciliary dyskinesia, that will be the answer. Because of that, both the systems of the patient are suffering. Clear? Yes. Tell me the answer to this. In the very initial period, we have ventral mesogastrium and the dorsal mesogastrium. And then there will be certain derivatives. Okay. Falciform ligament is present ventral to the liver, definitely ventral to the stomach. Coronary ligament is also related to the liver, that is in front of the stomach. Lesser omentum is between the liver and the stomach, that means again in front of the stomach. So they are all in front. But splenic is behind. So if spleen is behind, that is the derivative of dorsal mesogastrium and not the ventral mesogastrium. Right? Gastrosplenic ligament. Yes, that can be also true. Yes, Xavier, I will not deny that. But among these given option, which one will you mark? Among these given option, we will mark primary ciliary dyskinesia. है ना? क्वेश्चन के हिसाब से और गिवन इनपुट के हिसाब से हम आंसर लगा रहे हैं ना. वैसे तो डिफरेंशियल डायग्नोसिस में और चीजें भी आएंगी, दैट इज ट्रू, बट क्वेश्चन के हिसाब से हमें लगाना है. इन चारों में से कौन जस्टिफाई लगता है आपको? Epithelium of the ureter develops from. Now this is something very interesting. Why? Because ureter from the like when the kidney system is developing, ureter is a part of collecting system. So we have the two systems, excretory part, collecting part. They both are coming from different sources. Metanephros will make the excretory part. Mesonephros will make the mesonephric duct, which is going to make the collecting part. Excretory part is what? Nephron, like Bowman's capsule, PCT, DCT, loop of Henle, all of them, they are coming from metanephros. But mesonephric duct, which is going to make the collecting system, like we have the collecting tubules, we have the collecting ducts, minor calyces, major calyces, ureter, they all are collecting. So that will be coming from the mesonephros, mesonephric duct specifically. If mesonephric duct is given option, in that case, we will mark it. Okay. Yes. That's correct, beta. Yes, that's correct. And I do agree that it can be other possibilities are also there, but among the choices that we are taking, है ना? Very good. Type 1 collagen. Now, if you ask me, all of them, they can be the example of type 1. Yes. Because bone is a typical example, ligament and the aponeurosis are also typical example of type 1 collagen. What about cartilage? Cartilage can be written as cartilage because by and large, it is having type 2 collagen in them. It is having type 2 collagen in them. But if you look at the fibrocartilage specifically, it is having type 1 plus 2. It is having type 1 plus 2. That means then it is having type 1. So how can we say it is absent? Yes, even though cartilage like type 1 is dominant here in the fibrocartilage. But by and large, when you categorize, cartilage is usually categorized as type 2 cartilage. And among the option, like in the NEET style, what do they say? Mark the correct / most appropriate answer. So sometimes you may not have a single answer, like this question. We don't have any single answer because all of them are having the type 1 collagen. Or sometimes there can be two answers possible, right? So in this case, we don't have any answer. We have to mark the most appropriate. Definite answer will be cartilage. Now, hyaline cartilage of the respiratory tree extends up to what? Now, this is open for everyone. Please tell. Yes, that is also true. Particularly fibro तो बोला नहीं है, इसलिए भी हम मार्क कर सकते हैं. Very good बेटा, very nice input. अब ये बताओ, यहां पे आपने ध्यान देना है Bronchus versus bronchiole. Till the time we have the bronchus, we always have the hyaline cartilage present. As soon as we change the term from bronchus to bronchiole, the very important finding is cartilage absent. As you change from bronchus to bronchiole, whatever bronchiole, the cartilage will be absent in the bronchiole. That's a very important key point. So that's why up to bronchus only it will be present. Beyond that, it cannot be present. Next question. Space of Dissay contains all except. Yes, beta. बोलो yes में क्या लगाते हो? Space of Dissay में आप क्या लगाते हो question? Answer here will be Kupffer cells. Kupffer cells. Why? Why Kupffer cells? Because they are present. Kupffer cells will be present in the sinusoid. They are present in the sinusoids. Okay, they are traveling. You can say they are patrolling along the space of Dissay, not in the space of Dissay. Hepatic stellate cell, the ETO cells, they are present in the space of Dissay because they are the liver cells. The liver cell will be present in the liver spaces. What's the big deal about that? And what is the role? The hepatic stellate cell, they are involved in the fat storage and the fat soluble vitamin storage, DECA, DEKA. Okay, those are the fat soluble vitamin storage. And what about the pathological role of this ETO cells? Pathological role is fibrosis, like sometimes cirrhosis is there. Who will make the fibers? Like this is the cell involved in the fibers production. So far so good, dear friends. Could you appreciate this much part? Please remember Kupffer cells is a flow. It is present within the sinusoid. It is like phagocytic cell. Okay, like that. Now that we have understood this, let's move on to this urothelium lines all except. What is urothelium here? See, the urothelium is like, as the name is urothelium, it is present in the urinary system, correct? And it will be like, it is having a special property of distensible. It is having that, it can undergo stretch. But look at the tissue, it is a multi-layered tissue. Even after stretch, it remains multi-layered. This is truly multi-layered. So look-wise, it looks like transitional. Okay, because multi-layered is there. Looks like it's like stratified. Transition is the other name. Okay, transition is the other name of urothelium. Like where it will be present now, it is going to protect the tissue from the harmful effect of the urine also. So it will be present in the urinary bladder. Definitely, it will be present. Calyces, it will be present. Ureter, it will be present in the whole urinary system. It will be present. But so far as urethra is concerned, we have changing epithelium over there. So membranous urethra will be the answer over here. Why? Because if you look at the urethra, let me explain. Urethra, these are the parts where we have the urothelium present, first of all. Terminal part of the collecting tubule, calyces, pelvis, ureter, and the bladder. Along with the bladder, the proximal urethra means prostatic urethra. So if you look at this way, prostatic urethra will be having the urothelium because it is in continuity with the bladder, because at the neck of the bladder, we have the prostate present. There we have in continuity, transitional epithelium. But in the membranous urethra and the penile urethra, we have the pseudo-stratified columnar epithelium. Membranous is only 1 to 2 centimeter. Penile is around like 15 centimeter is there. Okay. So basically, we can consider pseudo-stratified columnar for a significant length. So remember, beginning is the urothelium, end will be stratified squamous, and in between, which is significant, is pseudo-stratified columnar epithelium. This is how we can remember. I hope that makes sense, dear friends. Is it all clear, everyone? So that was all, dear friends. And if you guys are there on the social media, I hope you will be on these platforms. So do connect with me on the Instagram, on the Telegram, and that's my YouTube channel. Okay, all the very best. Keep on studying hard. My best wishes to you guys. And dear friends, if you have any doubt after this also, we will be available for you guys. Okay, so keep on updating us. How's the preparation going on? If you have any doubt, any like maybe trouble in making schedules or any guidance, feel free to ask. Thank you so much.